Welcome to PCR London Valve 2025. I am Fabien Prat, an interventional cardiologist from Bern University Hospital. And it's a great pleasure to discuss today the result of a study that has been presented at TCT but discussed a lot also here in London, the ENCIRCLE trial that is investigating the performance of the SAPIEN M3 system. We will learn more about this system right now. And it's a great pleasure to be with two experts, Mera Guerrero from Rochester, Mayo Clinic, and Henrik Dreger from Berlin, who are users of this system and also contributed to the study. So thank you very much for being here. Mera, I would like to start with you and to congratulate you first for the publication of this study in the Lancet at the same time as TCT. And obviously we pursue the discussion on this study. What was the objective of the study?
Well, we know that mitral regurgitation is very common and associated with poor outcomes if we don't correct the mitral regurgitation, but not all patients are candidates for surgery for a variety of reasons, and not all patients are candidates for transcatheter repair options. So the objective was precisely to evaluate the role of transcatheter mitral valve replacement in those type of patients who don't have other treatment options.
So obviously a very innovative and new strategy for patients who are not candidates for edge-to-edge, but still transeptal access, which is less invasive to our patient. What were the results of the study?
Well, the study enrolled 299 patients who were symptomatic and had mitral regurgitation 3+ or greater, and who were not candidates for surgery or TEER. And the primary endpoint was the composite, non-hierarchical composite of death, all-cause death, and heart failure hospitalization at 1 year. And we compared that to a performance goal of 45%, which was derived from the outcomes reported in the randomized trials that compared TEER with guideline-directed medical treatment. So we found that at 1 year, the primary endpoint was 25.2%, which was much lower than the performance goal of 45%. That was the main finding of the primary endpoint. But when you look at the mortality, and specifically the 30-day mortality, was 0.7%. The STS score for these patients for mitral valve replacement was 6.6%. And when you observe 0.7%, that's an observed to expected ratio of 0.1, so 1/10 of the mortality. So we found high procedural safety, similar to TEER. And the third finding is that these patients experience significant and sustained reduction in mitral regurgitation that was associated with significant and sustained improvement in symptoms and quality of life, as well as reduction in the left ventricular end diastolic volume index.
So obviously all indicators are very positive and the good performance of the device. Henrik, you are using it in your daily clinical practice. Of course, that's not a daily procedure, that's a complex procedure. So how did you prepare your team to this new procedure, and what do you need as a requirement to be able to do it?
Well, of course, all these procedures are heavily based on great imaging. You need great CT preparation, you need echocardiographers who understand the anatomy and to also guide you through the procedures, and I feel that is the most important thing to set up such a program.
In which patient are you using it? There were primary and secondary patients in the study. Which are your preferred patients and how do you select them?
Well, actually we also use them in a mix of primary and secondary MR, but I think we tend to use it more in primary with patients that have some calcifications in the leaflets that basically make them unsuitable for TEER. So I think those were the first patients that we treated successfully.
So Henrik, you just mentioned patients with primary mitral regurgitation. One of the subcategory of this patient, very important one, are patients with MAC. So Mera, were these patients included into the study, and what is the plan to investigate these patients that need an option?
Mm-hmm. Thank you. Well, at the beginning we accepted some patients who had mild MAC, maybe a little bit borderline between mild and moderate. About 24% of the patients in the main cohort had mild to moderate MAC. But we quickly realized as soon as we started the trial that we needed to evaluate these patients in a separate category. So we added a MAC registry. So the results we presented recently are the main cohort. But we added a MAC registry that includes 100 patients. And we completed enrollment already. We hope to be able to present the results of that cohort next year.
So congratulations. I think it makes a lot of sense to look at this patient in a mechanistic way, to look at what is the reason of MR and investigate them separately as well. So congratulations on this, and we stay tuned for the future result of your trial and this cohort, and are very excited to see what is happening as a new option, innovative option for mitral regurgitation patient. Thank you very much for being with me and for making this interview together. Have a good day in London.
Thank you.
Thank you.